Hello, and thank you so much for having me. I am thrilled to be a part of the No City Limits conference and really thrilled to be in conversation with one of my sheroes, Jacqui Orie. Jacqui is a former nanny and organizer with the National Domestic Workers Alliance We Dream in Black program. She lives in Yonkers, New York, and is originally from St. Lucia, where she worked for the Attorney General. Jacqui was a nanny for over 19 years in the United States and has always been passionate about shaping the lives of young children. Jacqui became passionate about domestic workers' rights because of her own challenges in the workplace working as a nanny. She has had to work without a contract, without lunch breaks or overtime for working extra hours. And in 2018, Jacqui completed the Groundbreakers program at the National Domestic Workers Alliance to become a trained organizer and educator, supporting domestic workers through all of her incredible outreach and Know Your Rights trainings. I can't think of a more important time for her work and her leadership, and we're really excited to talk to you about how we move forward to truly address poverty in this time of crisis in our country. And I think, as we've all experienced, the COVID pandemic has shown us just how essential the work is that goes into caring for our children and our loved ones. It has shown us that home care workers are essential to keeping our nation's seniors and people with disabilities living safely and with dignity at home. Care workers have been on the front lines of the COVID-19 pandemic in every way. Nursing home and home care workers have held our loved ones' hands as they have passed, otherwise alone, in facilities devastated by the coronavirus or isolated in their homes and often unable to see their own families. Far too many care workers themselves have been infected by the virus, and far too many have died because their employers or state authorities have failed to provide adequate personal protective equipment, testing, affordable health care, and paid leave. Care workers have risked their own family's health to care for others, and many have had to make the impossible choice of going to work unprotected or staying at home without pay. And in the context of relief efforts, they've been among the first to lose income and among the last to receive support. The pandemic has highlighted how direct care workers in times of stability or crisis are essential to our society and too often treated as expendable. The National Domestic Workers Alliance launched the Care is Essential campaign to call on our elected officials to ensure frontline home care jobs and care workers are at the center of how we imagine our economic recovery as a nation. Care work, predominantly done by Black, Latina, and Asian women, is the backbone of our economy and our families. The 2.5 million home care workers in this country comprise the largest segment of direct care workers and one of our nation's fastest growing professions. 87% of home care workers are women, 62% are people of color, 31% are immigrants, and the annual median income for home care workers in our country is $17,200. Fortunately, the bold Biden-Harris Build Back Better plan is one of the first economic recovery plans in our history to center this work, to center the work of Black women and recognize the inextricable link between race and the economy. Care jobs are underpaid and undervalued because they are historically done by Black women, immigrant women, and women of color. The poor standards facing this workforce are a lens into the reality of work for millions of women of color in our country. With direct investment in long-term care work, domestic work, working people of all races, Black, Latina, white, Asian Pacific Islander, and Indigenous peoples will benefit By treating caregiving work as essential social infrastructure and creating good union jobs that pay at least $15 an hour and provide benefits, we can and we will build a more inclusive, resilient future in our country. I'm really excited to bring Jacqui into this conversation because she's been closest to people who are closest to the challenges that we face at this moment. And we know that people who are closest to the challenges and the problems are also closest to the solutions and in an amazing position to point the way forward. Jacqui, can you share with us some insights on the ways in which COVID and the many crises of 2020 have affected you and your community and the domestic care workers that you work with?
Thank you, Aichen. My name is Jacqui Orie, and I am really thankful to No City Limits for doing this amazing session. The majority of domestic workers are Black women and immigrant women of color. Their work, though critical to households and the U.S. economy as a whole, is economically and culturally devalued, with deep roots in the enslavement of African people. The domestic work industry was built on the centuries-long economic exploitation and social subjugation of Black women. Even today, domestic work is burdened with the legacy of racist exclusions from many of the basic labor protections afforded other workers. Black domestic workers have not been passive victims of substandard conditions on the job. From enslaved women's daily forms of resistance to the coordinated strikes of washerwomen in the late 19th century, to organizing initiatives pioneered by 20th century domestic workers. There is a long and powerful tradition of Black domestic workers organizing to secure justice and dignity in the workplace and in the broader society. With this in mind, the National Domestic Workers Alliance launched We Dream in Black, WeDib, in 2015 to build the collective power and visibility of Black caregivers, nannies, and professional cleaners.
Yes, and that work is so incredibly important, and it is incredibly timely now, given what we're seeing with domestic workers and care workers, especially women of color. And I'm just curious, I mean, you talk to domestic workers every single day. What are some of the stories that you're hearing? What are they facing right now and really struggling with?
And that's a really great question. Domestic workers have been really impacted by this pandemic. They've been out of work from March 2020. They have problems paying rent. They have problems putting food on the table, taking care of their families. Healthcare is a big issue among the domestic workers. They are the ones taking care of the families of our society. They are the ones taking care of the families of this nation, but they are not being taken care of themselves. So it is really, really important for us to understand these essential workers, these amazing caregivers need to be able to take care not only of themselves, but their families as well.
That's right. And so many have their own children, right, who are home from school, struggling with online learning and need care. And so many, it seems like they've been in this impossible situation of having to choose between caring for their clients, who they're also incredibly concerned about, and caring for their own children, their own loved ones. Many of them also are caregivers for their own aging parents or loved ones with disabilities. That is just, it seems like just a crisis of impossible choices for the care workforce. Would you say that's right?
I would say that is definitely right.
And for immigrant workers, what are some of the specific challenges that you've heard?
When we think of our immigrant worker community, we think of workers who are undocumented, who are fearful because they're undocumented to go out and seek the medical care they need, to go out to find, to get information on how to pay rent, how to get even healthcare because of this pandemic. These are workers who are going to work during the pandemic with no healthcare, with no way of taking care of themselves if they get sick. These are immigrant workers who do not have the documentation that other workers have to be able to access government assistance. These are the plights of our immigrant community.
And I know that as part of NDWA and We Dream in Black, we also have a vision for how we address these challenges, not just in the context of the pandemic, but how we recover into a stronger, more inclusive economy for the future. And I know that We Dream in Black has a beautiful vision called the Unboxed Agenda that is about putting the policies in place that allow for our care workers and our Black women to be able to care for themselves and their families too. Can you talk a little bit about the Unboxed Agenda and the vision that that agenda tries to bring us towards?
Sure. Thank you, Aichen. Yes. We Dream in Black launched the Unboxed Agenda in 2020, an organizing directive to give power back to the vision of Black domestic workers with 3 goals in mind. Goal number 1, to transform the domestic work industry so that domestic workers are included in all labor rights. They are protected from abusive conditions in the workplace, and they are paid the fair wages that they deserve. 2, center collective care and social programs that create infrastructure for thriving Black communities. And 3, disrupt the systemic and systematic harms that impact the lives of all Black women and domestic workers.
That is a powerful vision. And I know you all are organizing and in the trenches, trying to connect with domestic workers and care workers, bringing them into our community, helping them understand that they are not alone. And all of that work building up our ability to actually win some of these changes in this agenda. And there are clear policies that we know that it's not a mystery how we get to that vision, right? There are clear policies that can help us get there. Do you want to share a little bit about some of those policies?
Definitely. Some of the policies include the Federal Domestic Workers Bill of Rights, the importance of the Federal Domestic Worker Bill of Rights, and the expansion of safe working conditions, paid time off, and relief for domestic workers. Let's think about this. Some of the policies also include the Be Heard in the Workplace Act to prevent harassment, abuse, and ensure that all Black women are protected no matter where they work. The Healthy Families Act, which would allow many more Black and low-wage workers to earn paid sick time and take care of their families without losing wages or their jobs. We believe that universal family care is a reparative and bold policy idea that provides solutions to the glaring inequalities in our care system. by growing social insurance programs to finance support and compensation for family caregivers. Another is to move our country forward. We need care at the center of everything. The Breathe Act recognizes this and calls for investments in our community, including paid leave and paid sick time and comprehensive high-quality childcare and elder care.
Yes, so those policies are really important. And many of those policies are policies that women and families have been advocating for a really long time. And I would say that this pandemic, the kind of unexpected opportunity of this crisis, is that it has created such a disruption in the way that we all live, work, and care. That it gives us a chance to re-examine the kind of change that we need. It gives us a chance to re-examine what made us vulnerable to this crisis to begin with. And it gave us a chance to see a lot of things that most people in this country didn't see before, like just how many workers are working in low-wage, undervalued jobs that are actually essential to our health and our well-being, like care workers, right? Or grocery workers or farm workers. There's so many workers millions of workers who were working incredibly hard and still not able to make ends meet or have access to a safety net. And now we see just how essential they really are. Now we have the opportunity to not just applaud them, but change our policies to protect them and to make sure that their work has dignity and safety. We also have seen now everybody's grappling with caregiving challenges, right? We have the moms who are struggling to figure out how to support their kids who are tired of online learning and maybe are struggling to pay the phone bill to keep their kid able to access online learning through the internet, right? Or so many crazy impossible choices that families have been forced with when it comes to caregiving. It's also pushing a lot of women to leave the workforce so that they can focus on caregiving for their families. So we're seeing all of these kind of inequities, injustices exacerbated in the COVID crisis. Now that we see, we can actually move forward on these policies that you laid out because we have no choice but to act. And we have the opportunity to act boldly, which is so exciting to me. It's the thing that really gives me hope every day and helps me be able to look at our domestic worker members every day in the Zoom and say, we can get through this. And when we do, things will be better. I'm wondering, Jacqui, what your experience has been like as you've been talking to domestic workers. What gives you hope that we can realize this change going forward?
What gives me hope is the fact that we now have this amazing Unboxed Agenda. We have laid out a 5-year plan to see that these services, to see that this agenda is really realized. Of course, we understand that, our healthcare, our domestic workers are resilient, but they're also human beings. I'm so incredibly grateful to the strength of our domestic workers and to the community that they are building to ensure that this Unboxed Agenda goes through. This Unboxed Agenda is realized, is manifested this year in 2021. Yes, like you mentioned earlier, domestic workers have no safety net and benefits. And for too long, that has not reached Black domestic workers. The majority of them are left with not adequate pay. But I am hopeful. I am so hopeful that this Unboxed Agenda, as we push forward as a community, as a people, as domestic workers, it will get realized, it will get manifested, in 2021. So I'm really grateful and really hopeful about that.
Yes, I am too. And there's a lot of conversation about what is possible at the federal level right now, because obviously the entire country has been struggling through this crisis, and we need solutions to cover everyone in this country, especially the people that our policies have left behind, like Black women and like care workers. And I do believe that we have this moment as we think about our economic recovery plans to make big investments in our care workforce. I'm also really clear that there's a lot of opportunities at the local level in New York City, in cities across the country, in states across the country. Do you have thoughts on what is possible in the city, at the city level now, to start to move some of this agenda forward?
And that's really such a great question, because even right now, we are working on campaigns to ensure that domestic workers are included in whatever labor legislation that is being presented. We were really fortunate to ensure that we won actually 5 paid sick days last year, September 2020, where domestic workers were included in getting paid sick leave, 5 paid sick leave, as opposed to 2 paid sick days that they were entitled to after a year of work. So now our domestic workers now have 5 paid sick days. And we are grateful that they're continuing to push with us to ensure that domestic workers are included in the human rights law. We are now pushing for our Speaker Corey Johnson to pass Intro 339 to include domestic workers in the human rights law, because we know it's a no-brainer. Domestic workers are human beings. They deserve to be included in the New York human rights law. And so we are pushing that campaign, and we're believing that in 2021, before September 2021, that this legislation will include domestic workers, that we will pass Intro 339. So that's what we're pushing. We're pushing for domestic workers also to have access to 10 paid personal days. They do the work that is so important to this nation. And so they deserve time to not only take care of themselves, like I said earlier, but their families, to ensure that they remain healthy, to take care of the families they work for. So this is what we're doing at the city level.
Well, what I love about that story is that you're already seeing progress. This victory that you named on paid sick days is huge, a big step forward. Of course, it's just the beginning of what's needed, right? 5 paid sick days is still just the minimum that we need to start with. But that you are making that progress is a testament to the incredible community and power of domestic workers and care workers who are in motion, and the many supporters that you have in every sector of society to move this agenda forward. It's incredibly inspiring. And one thing that I keep hearing you talk about is about inclusion, about making sure that in our policies that no one is left behind. Right. We have this long history, right, of exclusion from basic fundamental rights and protections of certain categories of workers that has to do with our nation's history of racism and sexism and the way that it's shaped our policies, right? And our culture, right? To this day, we still refer to domestic work and care work as help. And it's actually a dignified profession for millions of people. Right. So we have a lot of change that we know is possible because the building blocks are happening at the city level and at the federal level. And we now have a moment to just make huge advances so that we can reset our economy as we reopen it to be more equitable and more inclusive, and to make sure that we don't leave anyone behind. And this is not just a moral imperative, right? It's actually a practical one, because as you said, domestic workers and care workers, they do the work that makes all other work possible. And without that work, others cannot go to work. I call these jobs job enabling jobs, right? These are jobs that when you invest in making them better jobs, it not only benefits those workers and their families, but it makes it possible for millions of workers across industries to also go to work knowing that their loved ones are in good hands. So it's also good economic policy in addition to addressing working poverty for so many women of color. So I think that that is really important for people to remember as we think about the way forward here. What else do you think our audience today? I mean, this is an incredible audience of influencers and decision makers and leaders across sectors. What do you think they may not know about care work and domestic work that is really important for them to know? As somebody who was a nanny for so long, what do you think people need to know?
And I want to start off with this. And you mentioned earlier racial oppression and the devaluing of household labor and the unregulated nature of care work. You know what this has done is create the perfect storm for care workers who are who had been excluded from significant federal and state law protections that most other sectors enjoy. Black domestic workers, as you know, have historically led struggles to improve the conditions of the industry. As a former care worker myself, I understand how important and necessary it is to have legislation put in place to protect the workers who care for the people we love, the workers who clean our homes, the workers who care for our children and our aging parents. There is still so much work to do. And so we're praying and hoping that the Domestic Worker Bill of Rights is passed on the federal level to ensure that domestic workers are included in labor and civil rights protections. Because no one knows the struggle of a domestic worker until you've been in the place of a domestic worker, until you've cared, you've spent hours working 12, 14-hour days, caring for a loved one, staying awake at night when that loved one is suffering from dementia, when that loved one needs help during the night, staying up all night, taking care of children. Children need love. They need boundaries. They need to know that there is a structure for them where they don't feel not loved, not just loved, but they feel safe. And so domestic workers and nannies and the caregivers provide all of that to families who have to go out to work, to take care of their own children. And so when the caregivers who give so much of themselves to this industry are not taken care of, something is wrong. And I'm speaking from personal experience as a former nanny in this industry.
Yeah. And that experience is really irreplaceable. I think one thing that people don't understand is just how much skill and dedication and the incredible emotional, physical, and intellectual capacity that is required to do care work and to do it well, and how little support there is for the workers in doing it. And often that isolation is one of the biggest challenges, right? And the kind of emotional stressors of that isolation. And one of the things that our organization and our movement seeks to really address is to bring people into community to help them understand that they are not alone. And when we come together, so much change is possible. And I think you've helped thousands of workers in New York see that, Jacqui. We're so grateful to you. And now is a time for action, right? So we've been seeing how everybody has been applauding essential workers,
Yes.
And we think that's wonderful because we need to recognize essential workers. And we also know that essential workers need more than applause, that domestic workers and care workers need and deserve much more than applause. So, what can people do, whether they are employers or leaders of different kinds? What can people do to support this agenda?
Great. And this is so amazing that you're asking this, because we are not just trying to reach the hearts of our congressmen and women, but society as a whole to support us, to push this forward. Call the congressmen in their areas, in their communities, and explain and tell them that care work, which is essential work, domestic workers also do essential work. They take care of their aging population. They take care of children. They do essential work. They are essential to care work in this country. And so we're calling on all members of our community, whether they are parents, whether they are employers, to help us push this agenda, to help support this agenda, to ensure that care workers, essential workers, are given the necessary care, the necessary legislation is put in place to take care of them, to help them take care of themselves. Because as they take care of themselves, they can do a much better job caring for our population, caring for our children, caring for our aging parents. And so we're hoping that not just our congressmen and women hear this message, but we're calling on our community out there, whoever you are, wherever you are, if you're hearing this message, support domestic workers, support care workers to ensure that they are included. They are included in every labor legislation that other workers get to enjoy.
Absolutely. And also for people who maybe hire a caregiver or a cleaner or someone in their own homes, there are lots of things that people can do right now to support safety, health, well-being for the people who make everything else possible in their lives. And we at the National Domestic Workers Alliance also have resources for employers. If you go to our website, employers.domesticworkers.org, there's lots of guidance on how to create a set of agreements with your caregiver that really support safety and well-being for everyone involved in this really difficult time in our country as we work towards the policy solutions that Jacqui named. And that includes giving a paid time off so that your caregiver can get vaccinated, or if they have side effects from the vaccination, to offer paid days off to recover. Things like that are gestures that are about how we, right in our own lives, right at home, can start to value caregivers, their work, their humanity, and their role in our families and in our economy. And I'm just so grateful to have the opportunity to be in conversation with you today, Jacqui, and to be in connection with this incredible community at No City Limits and through the Robin Hood Foundation of people who are focused on the most important challenge of our time, which is to address poverty and injustice in our society. And we are in it with you, and proud to be partners with all of you, and look forward to recovering from this pandemic in a way that lifts us all up and includes all of us, including our care workers and domestic workers. Thank you so much for having us.
Thank you.